Welcome everybody. I know there'll be a few folks that probably filter in the next few minutes, but I figure we may as well go ahead and get started. We have the session recorded. Um, and I'll let Jim kick us off with a bit of context setting, and then we can get into the more formal agenda here.
Good, great. Thank you, Simon. And thank you to our members in the group from Greenspace for joining us today. This is the second part of our kind of introduction around some of the measurement-based care, some of the platforms around it. But just to give a little bit of context, as Simon said, Greenspace and RCPA have been a longtime partner, the supporter of our conference each year. Did an amazing session this year, and really through our work with them and now through a formalized business partnership, we are very excited to continue what I really think is, and I said this to Simon, less of a kind of a product outline, but how do we build this community of practice, this community of education, and help guide members down this pathway. And I can think of no better group that Simon is leading in some of the foundational pieces to do this. I think one of the things, and my mind has not been changed about this going back, more than a year and looking at these pieces, and that is a relationship that Greenspace and this entity is trying to do as it relates to individual client care. And I know that from a practitioner's point of view, this is something that we strive for. And again, I'm very excited to be a part of this ongoing process. So I will turn it over to Simon. This again will build upon our last session, which was really kind of that formal education and introduction to it. So Simon, excited to see the next iteration of where we go now.
Perfect. Thanks for setting the stage here. I'm gonna share my screen. There we go. Yeah, this second session, I want to do a bit of a recap. I know we have a number of folks on that were not on the initial one, and we have the recording, and hopefully people have a chance to go back if they want to go a little deeper on the sort of the education side of this. Let's do a bit of a recap from the last session. I want to again give an overview of sort of the RCPA initiative that we've sort of collaboratively built here. And then what's new this time and where we'll spend the bulk of the conversation is sort of a walkthrough of the technology and what an integrated workflow looks like with your EHR system, and then a bit of discussion around like getting started and next steps and implementation. But the core of this is using the time in the way that's most helpful for folks that are on the call that are sort of evaluating whether or not to join this initiative. And so again, most of the time in sort of technology integration implementation, but lots of opportunity for questions, discussion, and all that. And as I did last time, I'll encourage folks to interrupt me as I go through here, whether you want to put, kind of raise your hand, I'll see that, and I can unmute or allow to talk on this webinar. Or if you wanted to put questions in the chat, like I think that'd be a good way to make sure we're not leaving everything till the end. So without further ado, quick recap from last time, right? So background on Greenspace Health. We're an organization that enables measurement-based care. We were initially developed out of an academic research hospital. We're currently supporting more than 600 behavioral health and substance use focused organizations to implement measurement-based care. We'll do a quick recap of the definition of measurement-based care, but I've been working with RCPA for several years and with a number of RCPA members on their implementation of MBC. I think this is a great opportunity to sort of take things a step further, introduce more coordination across members, and deliver more value for members. What is measurement-based care? Again, we went deeper on this last time, but if I simplify it down to this definition from a 2015 research paper, it is the routine collection and use of client-reported progress measures throughout treatment to guide clinical decision-making. I find this visual helpful. When we come in and partner with organizations, most often their use of measures for a client looks like the current state graph on the left. we, are often doing measures for reporting purposes. Maybe it's a pre and post model of measurement. It's highly manual, and it's typically not, a process that's delivering much clinical value. And as a result, we see, challenges around adherence, challenges around getting measures done because there's not an agreed upon end state to treatment. And so when we look at the data sets of partners that we're coming in to support, we're often seeing like an average of like 1.25 assessments completed per client. And so it's not going to achieve our goal of measurement-based care and actually impacting the care trajectory of clients, but it's also not going to achieve our goal when it comes to understanding the outcomes as an organization. So the shift to measurement-based care is where we're doing this consistently throughout treatment. We're measuring across multiple domains, and ultimately we're shifting the trajectory of care and doing so in a way that's more useful and more valuable for clinical teams. So that's my quick recap on the definition. Um, we asked a few questions on the last session that I just wanted to call out. This sort of an end of session survey that went out to folks and really appreciated everybody who spent the time to complete it. Um, what level of priority would you assign to implementing MBC? Across the responses, our average was 4. So high priority in terms of implementation of MBC. Obviously, a little bit of bias in terms of those organizations joining this call are probably already interested in this topic and thinking about it, but clearly, groups prioritizing this area on average. What would be your number one driver for wanting to implement measurement-based care? Improve client outcomes, demonstrate program effectiveness, prepare for value-based care, enhance clinical supervision. I appreciate the clarity in response. Like these were not multiple choices we gave to folks, and people essentially listed off what I would describe as 4 of the most important like drivers of organizations investing into measurement-based care. So I appreciate that. And then what would be number one concern and barrier? So funding and resources, duplicative data entry, leadership buy-in and organizational alignment, and limited staff capacity for analysis and reporting. These are great callouts, and I think we, appreciate again, the clarity of thought and the insight that are shared here. Um, on the first topic, this idea of limited funding and resources, we can kind of come back to that at the end. We sort of work with a lot of our partners to build out a financial ROI model, to be able to show how this is going to deliver kind of return on investment within the first year and a lot of opportunity to be able to use your outcome data externally. So that's a conversation we can have, but wasn't the core of the focus of the conversation today. I think when we get into duplicate data entry, the EHR integration is the solution here, and we'll talk through what that looks like across different systems. And then I'd say the last 2 items around leadership buy-in and staff capacity, we can talk a little bit about implementation and change management and the role that we play there. I think what's really important, and Jim mentioned it up front, like the work we're doing with our CPA, the work we're doing across organizations here is absolutely to support these last 2 items, right? When we work with an individual organization, like our team brings a lot of subject matter expertise, training, resources, and has a process that helps teams get that buy-in at a leadership level, at a clinician level, and really supports teams with how to kind of work with and understand the data that's coming out of this. Um, but I think the extra step we want to take here, as part of this coordinated initiative, is being able to better support, like put more resources behind supporting each of these organizations, share best practices, share resources, and ideally make each implementation more effective. So appreciate that commentary from last session. Hopefully it's a helpful flavor of how others are thinking about measurement-based care. So maybe the last recap item. What is this initiative? For those that were not on the last session. So 4 goals or objectives, I think, is a good starting point. Increase our CPA member adoption of measurement-based care, partly through reduced costs and partly through making implementation easier. Expanded implementation support, expanded clinician education, learning and working collaboratively with others. Number 2, to the extent possible, promote some consistency in terms of the measurement-based care approach used across members. It enables, again, better shared resources, better learning from others, it also enables item 3 and 4, right? So if we are saying that in this child and adolescent level of care, we're using these measures, not necessarily required for everybody, but as our core set of measures, we're then able to generate a benchmark in Pennsylvania across RCPA for that level of care. That makes this really, really useful when you have context for the sort of outcomes and data that your team is generating. And so the more we can create consistency, the more value there actually is across organizations in sort of sharing data and learning from each other. And then the last piece is, to the extent possible, using this data as individual organizations and as our CPA to support value-based care and advocacy efforts, to be able to clearly speak to the impact that organizations are having and clearly speak to a lot of um, intent behind how organizations are measuring, as opposed to being at the whim of a payer or MCO who comes out and says, hey, now we want you to measure X, Y, Z. Like being able to stand behind, hey, here's the rationale why we're actually measuring ABC, and this is standard across, our agencies in Pennsylvania, and here's why we took that approach, and here's the data set that sits under that, and here's the benchmarks that sit under that. Being able to come to that conversation with depth and be proactive around any reporting that's presented or any value-based care models that are presented. Terms of some of the kind of key benefits in the short term and what we're supporting, enhanced training and implementation support. We're going to facilitate with our CPA a community of practice to share implementation strategies, lessons learned, best practices. We're also going to be able to draw on some of our partners that have been live for in some cases a few months, in some cases several years, and some of their learnings and resources I think will be really valuable. As I mentioned, being able to build a benchmarking dashboard so organizations can put their data into context across others within our CPA, and then discounted pricing. So these are all components of the RCPA initiative that we've set out. Okay, I'm gonna take a breath here, drink a sip of water. If anybody has any questions at this stage before I get into the technology and the integration workflow, now would be a great time to just put up your hand or put a message in the chat. Otherwise, I'll take a sip of water and we'll give it 30 seconds.
So, Simon, thank you. And while you get your sip of water, I think one of the things to highlight that we really kind of looked at a little bit was one of the questions around the adaptability and the interoperability of the model. And I think that's one of the features that hopefully, as you do the technology walkthrough, we can kind of shadow on.
Yeah, that's great. And I know we've had some conversations about that. So it's a helpful call out. And I'll flip a little bit of the order as well. Like I actually might talk through integration and then do the technology walkthrough. That sometimes is a more helpful way to be able to picture what it looks like within an integrated implementation. Um, maybe as we get into it, my ask to folks would be if and I'm sure not everybody's got to put this in, but if folks wanted, if you wanted to throw the EHR that your organization is on into the chat, that'll also help me like tailor this conversation a little bit to those specific systems. And yeah, if you throw it in there, we can get more specific to your team systems. Great, we see a couple well agents. Looking across names on the names that I recognize. I know we've got a NetSmart MyEvolve in here somewhere. Oh, 3 well agents. All right. Their avatar, great. Cool. Well, I'll jump into it, but it seems like at least of the ones listed here, we've got a few well agents. NetSmart My Avatar, again, from a couple names I recognize. I know there's a NetSmart My Evolve. Let's as I mentioned, let's talk a little bit integration and then I'll go into the kind of live walk through the technology. So we support integration with almost any EHR system, certainly with Welligent, Avatar, Evolve, and others that are sort of your core systems you'll see across our CPA. There's a little bit of a quick overview of some of the key functions of integration, whether that's kind of patient registration or sharing of assessment results, et cetera, et cetera. We'll get into more of those points in detail. I think the last one or last two I'd call out probably around trust and secure standards and full service approach. Um, with each of these systems, the integration is using a standards-based approach. And so typically that's HL7 or FHIR. And what that means is like we're doing this in a way that is validated and secure in healthcare, but maybe B, and more importantly, like, this is built in a way that's scalable. And so it's not like each new integration on Welligent or a NetSmart kind of EHR is its own custom project. Like, yes, there is workflow design and determining, based on the fields on the EHR, what assessments are going to be automatically assigned. Like, there's some configuration there, but we're not building this from scratch, right? And so it makes these projects much more seamless at a much faster timeline. And this is something that's fully led by our team with support from the EHR vendor. There is not a technology project or IT project that you need to turn your team's resources towards. Like, absolutely, IT is often involved in these projects, but the kind of connectivity and configuration and build out is sort of on GreenSpace with support from the EHR vendor. So I think those are a couple key call outs up front. In terms of the integrated workflow, I'll talk through it in this slide. We can get into more detail if folks have questions about each item, but I'll talk through the workflow and then I'll show it live in the application. So sort of the first use case I have flagged here is automatic client creation and updates. So what we want to structure is when a user completes their standard actions in the EHR system, like they would today, we're going to automate the measurement-based care flow behind that. So when somebody enrolls a client in a program or transfers them, or there's a discharge flow or updates, their profile or demographics, depending on the information and kind of trigger events we set up in our configuration, it's automatically going to enable things to happen on the GreenSpace side. So for example, if Simon Weiss is added to a partial program within this organization, we've decided that I'm automatically going to get registered or enrolled with measurement-based care. Maybe I'm in an adolescent-focused program and you want to also, send measures or tools out to parents or caregivers. They might also be added. I'll be associated with the right providers, with the right program. There might be discharge or transfer flows that happen. You might want to bring demographic data over. That's all automatically sort of synced between EHR and GreenSpace. Next, we're also going to want to automate the setup and assignment of assessments. So depending on certain data fields in the EHR, most common would be like program, diagnosis, age. We're going to pre-configure the assessment tools that are assigned. So let's see, if Simon's in the partial program and has a presenting diagnosis of depression and is an adult, he is therefore going to get, a depression measure, maybe there's a functioning measure, maybe there's a kind of therapeutic alliance measure, maybe there's something else you want me completing. That can all be standardized via the integration. So in use case one and use case two, we're setting this up so that the clinician or administrator doesn't have to do anything to enable measurement-based care, right? Like, it can all be automated in the background. There's lots of control. They can change things, they can go in, but ultimately we get to standardize a workflow and drastically reduce clinician and administrator effort. Next, assessments are going to be delivered and completed by clients. We want multiple options and workflows for how that can happen. So it might be, and I'll show you some of these live, but it might be by email, it might be by text message, it might be a tablet in the waiting room, it might be a QR code in the waiting room, it might be a link in your appointment reminder email. We need multiple methods for assessment completion. And then ultimately, we need the results flowing back into the EHR so the clinician doesn't have to leave their EHR to see what's going on and to bring this into the conversation in session. Depending on the EHR, there's going to be different use cases that are enabled. In some cases, like with my avatar, I saw somebody was on all three of these use cases, I know they're out of order for some reason, so we'll work on that. Use case 4, 3, and 5 are all enabled. So there's a visual document that comes back into the EHR. There's a single click from the client chart. On NX, it's in the control panel. You hit a little icon and it pops out the client's interactive results display. And then we're also passing discrete data back into the assessment forms in the EHR as though the clinician had entered that information directly. So that's the integrated workflow. I'll jump into the product and show it live, but hopefully this gives a sense of what the actual workflow and implementation would be like for a clinical team. And again, feel free in the chat to ask any questions or put your hand up. I can sort of see the participant list here and I can call on you. Okay. So I've jumped into the Greenspace application. And essentially, and Jim, maybe I should confirm, you can see this, right, with Carrie Douglas here? Perfect. Okay. Sorry, one second, Jim. I'm going to ask you to fill some airtime here. I've got my wife and baby locked out and have to quickly go open the door, so I'll be back in 30 seconds.
No problem. I'll fill it as best possible. So, as we kind of jump into some of the pieces around the technical platform, what are some of the important areas that you're looking at, kind of as you have your introduction to these types of um, case management, some of these platforms that are using AI or using measurement-based care? What are some of the things that are important to your organizations as you kind of move through this? Wow, that was really quick.
Just sprint down and up the stairs. Give people a moment. Again, in the chat or via sort of putting your hand up. The more we can tailor this to everybody's context here, the better. So would be great if, Jim, I think that's a great question. So it would be great if there's anybody that wants to call out items that are like particularly important when thinking about this.
Well, maybe as we proceed, folks will be a little more
Vocal.
vocal, right? All right, I'll pass it right back over to you.
All good. All good. Okay, so I'm in the Greenspace application here. We'll use Carrie Douglas as our pretend client. And again, as I mentioned, this is all populating automatically via the integration in terms of based on how we configure it for your organization and programs. So make sure I see the participant list. Perfect. So we'll see here we've got 4 measures assigned with a sort of a different frequency by which they're being sent out to be completed. This PHQ-9 is set to manual. If I wanted to come in here and really adjust the, sorry about that. Jump back in. Somebody else is playing around in this demo account. Okay, if I wanted to, let's go back to Carrie. All right, so if I wanted to adjust the schedule here, I can. Again, this is typically set by the integration, but maybe I wanted that PHQ-9 to go out, next delivery date can be later this week. Let's say I wanted it at 2 p.m. I want it to go out every 2 weeks and stop after 5 deliveries. You can get pretty specific in terms of the schedule that you're setting for a measure. As I mentioned, there's going to be multiple ways that clients can receive and complete these. You also have a lot of flexibility over what assessments are available. Within this demo account, you can see if I go to add assessments, there's different measures I could kind of scroll through and select. Maybe I want to add this functioning measure, which I could go and assign and schedule. I could also look at the assessment guide. I can actually see a sample of that assessment if I'd like. This is sort of preset for your implementation. There's 500 plus assessments in our database. We can also add anything else that your team needs to use or would like to use. But the key is we want that flexibility for clinicians and for the organization around what measures are being utilized. In terms of delivery of assessments, um, we've got these four measures here. Carrie, our example, is set up to receive these by email. That's the default method for Carrie, but also able to complete them on a tablet in the waiting room with a code. So let's just show the email flow first. I'll just manually trigger GAD7 to go out by email. But on the next delivery date, which would be December 2nd at 7 a.m., this would have automatically gone out anyways. And it'll be the same workflow whether I'm triggering it manually or it's automated. So if I go over here into this demo account, let's refresh. And great, we've got this new email for Carrie to complete their next assessment. Note that this is all rebranded for the organization. So the client isn't actually interacting with Greenspace. They're interacting with Meraki or Path or Community Services Group. Um, and it's a more integrated experience for the client. They receive this email. All they have to do is hit the button, complete assessments, and right away that assessment's opened on whatever device that they're on. Um, the same workflow exists in text message. You receive a text, you click the link, and then the measure is going to open right away on web browser on somebody's phone. I'm on my laptop right now completing this, but if I'm on mobile, it's going to look and feel like a native application. Go to DevTools. It's going to look and feel like a native application. But there's nothing new you have to download. Like you don't have to download an app. You don't have to create an account. It's pretty straightforward to walk through and complete. Great, let's hit submit. And if I go back over here to manage patient and refresh, we're going to see that we've got that GAD7 now completed on November 10th. And I could go over to see results if I want. The other method that I'll call out is sort of that kiosk or tablet-based workflow. This is also a link that's consistent across the organization. So you could use it in a QR code. You could drop it into any kind of chat if you're delivering virtual care. You can drop it into appointment reminder emails. Like there's lots of ways to utilize this link. But let's say Simon's walking in for a session into the waiting room. You could hand me a tablet or put up a QR code, and I could enter the required information to be able to go complete now. And then my other outstanding assessments are going to appear here for me to walk through and complete. And I'm not going to walk through the working alliance inventory at 16 questions, so we'll save the time. So great, we've got these assessments completed. What do the results look like? And ultimately, this is the core of the core of the clinician effort, right? We're trying to automate as much as possible, but ultimately we want to engage clinicians to get value from this information and bring it into conversation. So I'm in the Greenspace application now, but as I mentioned, like this will come over as a visual document to the EHR and within both Welligent and Avatar and also within Evolve, there's sort of an area in the client chart with a one-click button to pop out the interactive display. On this display up top, you're going to get a summary of key insights. So interestingly, we've met a reliable recovery threshold in the GAD7, but have seen recent deterioration. If I want to get more detail here, let's scroll down. And we can see what's gone on that GAD7 over time, see a breakdown of the underlying items as well. Depending on the measure, you're going to have different visualization models. So I think the QFE30, we're looking at 3 subscales over time. There's about 8 to 10 different graphing models, kind of depends on the assessment. And we've also introduced this feature where we can specifically look at, are there any symptoms that are flagged that we should spend time on? So on that GAD7, we just had a recent 2-point deterioration on this particular measure. And there's an automatic prompt that we can generate that you can use to bring this into conversation. And maybe you want a new prompt. So that was too casual. I want something different. So great. In the last 2 weeks, you've been feeling nervous, anxious, or on edge more than half the days, an increase from before. Does that match how you've been feeling? So when we look at the research on measurement-based care and we look at the practical experience of our partners, a lot of the value and kind of the key activity in session is actually looking at underlying items and how certain items might have trended or changed, or certain issues the client's really dealing with, as opposed to looking at the top level score. So this kind of flagged and improving symptoms model is a way to help clinicians with that exercise and really bring kind of key talking points into discussion. And there's more investment coming on the results display. There's sort of client level benchmarking and predict treatment response that's going to come out shortly. But this is definitely kind of the core area we want clinicians to engage with and sort of use this information in session and in treatment planning. So um, I'll shift gears a little bit now. I've kind of talked through that core workflow of measurement-based care, certainly how the integration looks, what's actually happening in the background from a Greenspace perspective, how do we visualize results at the client level? The next thing I want to talk about is analytics. So if you're a kind of manager, clinical leader, supervisor, um, you're likely to engage with kind of the analytics here on the application. And this is within this demo account. There's a number of dashboards enabled, but the analytics module is configurable for an organization. And that includes, the dashboards we're enabling, the filters we're enabling, the underlying data tiles and visuals, if I wanted to click into a data tile, what are the underlying data tables that sit there that we can kind of look at what's going on. So highly configurable. The key views I'll talk through. First, actually, I'm going to go to clinical outcomes, where we can see across assessments, normalized scores or normalized metrics on outcomes, which are reliable improvement across assessments. So 42% of clients achieving reliable change, 33% of clients achieving recovery, and then this concept of reliable recovery, 30% of clients achieving reliable change and recovery. These are kind of the most evidence-based ways to look at and define outcomes. But there's other ways to kind of cut the data and look at the data. If I wanted to go deeper on specific assessments, we'll use the PHQ-9 here as our example, but we could obviously look at different measures. Maybe I want to filter this down by clinic or a specific tag, like show me clients in CBT modality, started their episode, before 2 months ago. I'm not going to refresh this because I don't know the data quality under it, but you can definitely get pretty nuanced in terms of what you're looking at. And we've got some data tiles that show, number of responses, number of clients or cases that are engaging, average score by response, reliable change being a key outcome metric, reliable improvement by response, symptom severity change from first to most recent, what are our cut points, Sankey graph on symptom severity flow. So I might want to see, hey, everybody started at moderate, severe depression symptoms. Where did they move to? And maybe I want to see, which clients actually deteriorated from here. And let's click into that slice of the graph and see which clients that encompasses. These two initials. Let's click into client with the initials AB. We'll zoom here. We can see, this looks very different than Carrie in terms of reliable deterioration on these measures. We're seeing a negative functioning trend, and maybe we want to go a little bit deeper on some of them to go into the actual data. So for us, the ability to go from aggregate to actionable is a really key use case for our partner organizations. And again, lots of different ways to visualize data. Hopefully this is giving a good flavor for how some of our partners are kind of using this and looking at outcomes. Another kind of use case I'll call out, which is pretty common in clinical supervision, will be this caseload assistant. So being able to say, hey, which clients across this caseload, which I might want to filter down by providers or otherwise, require attention for different reasons, whether it's recent suicidal ideation markers, low engagement, stagnation or deterioration trends, low therapeutic alliance, et cetera, et cetera. And for any of them, I could actually click into the results and go a level deeper. And then depending on your use case as an organization, like this is going to flow into your other kind of analytics and reporting you might be doing direct through the EHR if we're mapping discrete data over. If you have your own data warehouse or kind of data system where you're doing analysis, you can pull directly down either as reports or directly from our API into those systems. And so you can not just look at sort of Greenspace outcome reporting, but match this into other reporting sets that you have as an organization. Um, so a lot that we can get into that can be pretty specific to each implementation, but that's often a big part of the work we're doing with our partners. Um, let's see, is there anything else I wanted to touch on here? Yeah, I think that's it. That's it for the moment from a kind of a technology walkthrough perspective. Um, I'll switch gears in a second just to talk a little bit about implementation and timelines and what that looks like. But before I do, any sort of questions or comments here before moving on from the technology? And again, please put up your hand or put a note in the chat. Okay. Um, let's move over back into the slides. I'm just going to click through the integration ones quickly. We don't have to go so deep on those. All right, so I've got a few slides here just on like where do we go from here? What are next steps and a little bit about implementation. So I think in terms of this specific like this initiative in this conversation, one point that I think is important to make is that there is flexibility in how organizations phase this in. With many of our partners, they're picking kind of 2 or 3 programs to start with, focusing on really succeeding on implementation within that slice of their organization and then expanding from there, not just when you're demonstrating that the implementation is successful, but also when you're demonstrating the ROI and sort of financial return on investment. Um, I think in terms of continuing that, where do we go from this kind of demo and walkthrough and discussion about the coordinated initiative? Um, ultimately, the next step is a specific conversation where we get to go deeper around what the implementation could look like for your organization, depending on the EHR you're on, what your goals are, what kind of programs you're running, what your reporting needs are, and getting into quite a bit more depth on like what the opportunity is for your team. So these are sort of next steps in getting started. I had some other slides just on implementation and change management that I dropped into an appendix that I can talk through given some of the kind of survey feedback we had before. And so maybe I'll share a couple of those, and then we'll leave 15 minutes for questions and discussion if folks have it.
That-
Go ahead, Jim.
I was going to say that would be great. I had one about cultural footprinting this, but go ahead. I'll
Huh.
pop it in when we get there.
Okay, perfect. So I've got lots of. I wanted to narrow down the resources we were sharing on implementation planning and change management. There's a lot here. Um, I think this is sort of a simple overview of what a typical implementation timeline looks like. Um, there's kind of 2 tracks, like a kind of technology track or integration track in blue, and sort of an implementation education track in yellow. Um, you're typically spending a month, sometimes a little longer, sometimes a little shorter, just on planning and sort of requirements for and goals and sort of what are we tracking from an ROI perspective upfront. We're then jumping into sort of workflow discovery and determining how are we actually configuring the integration. We then shift to EHR connectivity, config, and integration testing as a flow. In parallel to all of that, we're creating an education plan and a change management plan, or starting to do this work in month 2. And then we're moving to sort of that education and training being delivered in month 3 in advance of go live. Um, so that's typically the approach. We call out this kind of adoption phase. I would say it's typically the first 2 to 3 months post go live that are the most, I don't know, what's the right word for it? It's a really important phase where our team remains really hands-on because we designed this on paper, we've configured an EHR integration, we've gotten feedback from teams, we've done education, we've done training, but then you see it actually roll out. And
many times there aren't changes that are needed to the integration. It works smoothly, but maybe there's some additional resources the team needs on how to introduce this in session. Maybe there's some additional education we need. Maybe we need to take a champion who's really succeeded in the first month or two and have them share out their stories to the rest of the team. This is really the most like creative and custom part of implementation where we're learning about what's happening in practice. And then, we got this whole toolbox of strategies on education and change management and technology. We can also update the integration and the workflows. Like, how do we see what's happening and adjust? And that's really a high leverage time to be able to make this really successful for a program or programs where we're implementing. So that's kind of the timeline and stages overview. When we think of our kind of approach to training, um, think of it in a pyramid, right? We have a pretty extensive library of educational materials and LMS course and all that. We'll work with your team to build a tailored plan. We'll build custom resources as are needed to reflect the EHR integration and your team's workflow. We'll obviously deliver live training sessions and then ongoing support, and especially during that adoption phase, look really closely at the sort of the metrics and the data we're seeing on how this is being implemented and used. Um, so hopefully that's a good kind of a good overview here in terms of kind of implementation timeline and training approach. Um, there's a couple comments up front in the let me go find them just from the survey following the last session um, around buy-in and organizational alignment, around staff capacity. I think this is all part of the conversation, right? Depending on kind of current state for your team, resources, the level of understanding today of measurement-based care, what you're doing today from a kind of measurement and reporting perspective, like the implementation plan is going to look a little bit different. But ultimately, the goals tend to be pretty similar, right? The goals come back to how do you do MBC really well to impact care outcomes and impact client engagement with care? How do you kind of use this data to understand and demonstrate program effectiveness? How do you kind of prepare for value-based care? How do we kind of work across organizations under RCPA to build a data set that enables that external conversation, gives context to data? Um, like there's a lot here, but it kind of starts at that, you know, I'd say pretty standard implementation and change management strategies and a practice that we know is going to be effective if we can get it in place and make it clinically useful. So I'm going to stop there. Jim, I know you had a question, and then obviously let's open it up to the floor in the last 15 minutes here.
I did actually a couple, but the first one was you kind of described kind of introducing this and kind of a multi-level or layered approach, and it will differ for every agency depending on where they're at in the process. But just as just laying some groundwork out for the individuals on the call, as I see them, they represent the leadership of their individual agencies. Some are CEOs, some are C-suite level
Mhm.
managerial. What's the message for them to talk to their clinical staff or their staff around ideas and movements to this? Are there any kind of highlights or bullet points?
Yeah, great question. I think first I would say it depends on kind of current state for that organization, right? There's maybe a few different, I'll kind of bucket groups in bucket organizations into three groups, right? There's the organization that has no prior experience with measurement-based care and use of assessment tools. They aren't really using this data much. They're not using it for reporting. Um, there's then the group where they're doing assessment tools for reporting. It's typically a manual process. Then there's a third group that has probably taken a few more steps towards doing this consistently in care and has put in like done a lot of education probably already on why they're trying to get to MBC. So I think the message differs across those types of organizations. For I'd say for the group that has less experience with measurement-based care, and this probably applies to the first and second group I'm talking about, like I think it starts with like foundational education, like why we're doing this, right? So the literature, the evidence that shows that this is best practice, this is going to deliver better care outcomes and sort of patient or client engagement with services. Um, I think there's a message around how this is becoming a standard of evidence-based practice. Like we could point to the Kennedy Forum, we could point to the APA, we could point to National Council. Like there's a ton of work happening nationally on the importance of this work because of the clinical benefit. I think we can then tie that into sort of local or specific requirements that organizations have of like, hey, if we're CARF for Joint Commission accredited, this is now a requirement. And so we're in this place where there's a shifting landscape. This is better for clients, but it's also becoming a core part of delivering the services we have to deliver. And it's eventually going to become a core part of getting paid for delivering the services we're delivering. And so we want to take the opportunity to invest here and give you, the clinicians, more resources and more of an opportunity to make this clinically useful. And so I think framing it around the value and the shift in the space and making it clear that this is not another reporting exercise or data collection exercise. This is about clinical value. um, I think in that third group where you've got a clinical team with more experience around this, you've done a lot of the groundwork on education. There you get to focus a bit more on the technology, right? There you get to talk about how the integration makes this easier, about the automations, about the kind of results visualization, about the analytics. But for the first two types of organizations, it's much more foundational around why do measurement-based care in the first place.
Thanks.
Well, all right, folks, we have a quiet group today, quieter than last time. This is your chance. If you can throw any questions, comments, thoughts in the chat or raise your hand, would love to make sure we're answering things here today. And folks are leaving this conversation with a really good sense of what this initiative is, what the opportunity is.
Well, I'm going to throw a question in there because you mentioned this, and that was the shifting landscapes and the uncertainties around where we're going. We're Pennsylvania. We still don't have a budget. We're almost halfway through the budget year, and we know there's changes in Medicaid. I guess the question is, what are some of the concerns that you have around this shifting landscape in the movement to measurement-based care and its return on quality, but also knowing that payer requirements might look a little bit different, a move to higher
Yeah.
reliance on value-based care. Anybody around those concerns or how the shifting landscape kind of weighs in on your decisions around these types of things?
Well, maybe while folks think about that question, Jim, what I've heard from, I mean, some of the groups, like folks on this call who might be a little quiet today, but also from partners of ours and some other organizations we're talking to under our CPA. Um, there's an, I think some groups are feeling a need to be more proactive around measurement. And there's kind of that never-ending stacking of reporting requirements. If you're an organization in the Philadelphia area that's CDH funded, they just announced kind of a reporting requirement and said everybody's got to send us, PHQ-9 and SDOH measure results by HL7 into this database. Like these requirements are coming, and if organizations have invested in the practice, understand the right measures to be using within different populations, ideally are part of this initiative with our CPA so we can kind of build a stronger coalition around the right way to be doing measurement. Like more groups can be proactive, the more they can stand on two legs in that conversation and say, no, we should do it this way, or no, this is the more clinically validated way. My fear personally, and somebody who has sort of vested interest in the sector, is we end up in a place where organizations have all these reporting requirements from different places, and it's just that it's reporting, right? Like we need to be doing this in a way that's clinically useful, that benefits the clients, not for the sake of reporting because somebody told us to do it. And that's the lens that hopefully groups see and can get excited about. And anybody else on that topic? Like, what are you seeing? What are your thoughts? What are your fears around, payer requirements or MCO requirements or otherwise?
Now's our opportunity. I'm going to put Mike and Sherry if you're on. Mike Donovan and Sherry Brummins, they lead up the Alliance of Philadelphia Providers, and they have quite an array of service providers, but also deal almost specifically with CBH. What are your thoughts around your members' preparedness or thoughts around these types of measurement based type programs? If you could give us your thoughts on that. There's Mike.
Hey Jim. I have to give that a little bit of thought. Thank you, Simon, also for the presentation. This was very impressive. I really was. I think I saw a lot of possibilities just with the kind of interoperability and the integration with so many different systems, which was really very impressive. So I'm a fan. Um, Jim, I'm, I think, I'm still, it's a good question. I have some thoughts, but I'm gonna be clumsily inarticulate right now. Um, uh, give me a minute on that one.
Can you guys hear me?
Yes.
Yeah.
Okay, good. I couldn't get myself unmuted for the longest time and I kept trying, so I'm so sorry. This is Sherry Simon. Jim knows who I am, so hi, nice to meet you.
I shared.
We just had a really nice call this morning with two of your people for the first time. I'm not sure if you were even aware that it just happened to be today was our call, and then we found out about this during the call and decided that we would, go ahead and hop on. So it's really good questions. We're not sure. I haven't known about this project for long enough to really get a handle on it, but I was hoping to listen to it today and then give some thought. So it's just like a kind of a, premature. I think that's why Michael and I are both struggling. We are just hearing about it today. So
Okay.
I certainly with CBH, there's no doubt that there's a need for things like this. I just don't know where providers would be utilizing it, what kinds of what outcomes they would be looking for, and how they sort of match what CBH is looking for and all the other MCOs. So Jim, you might be aware of what other MCOs are looking to do and asking for throughout the state, but
I think
Sure.
too, Jim, there's no question that if it couldn't be used this minute, it could be at some point. One thing we said this morning to Tanya, Simon, was there's always some new requirement coming down the pike.
yeah.
If not sooner, later. And most of
Yeah.
the time it's sooner.
I agree. And Sherry, Mike, thank you. I apologize for putting you on the spot, but
No, that's okay. We just
in
wish
true
we had more to
fashion, you
say,
do
that's all.
always you do
Yeah.
always respond and you're
I always do
thinking
it
on
to
your
you,
feet.
Jim. Don't worry. It's fine.
I guess I look at what the requirements are, and we mentioned CBH on a couple of things, but you've got Magellan, you've got CCBH, you've got Perform Care, you've got Carillon, and I think as this moves forward, some of the uncertainties around Medicaid, the fact that we've had such a quandary over the capitation and funding it, we can call it whatever we want, but I think we saw belt tightening by all the MCOs on some level, whether it was the way services were authorized or not authorized. I think the shift on where we're going, um, I guess it makes it concerning on what are we going to need, what do we need to measure, how are we going to measure it. Are my notes going to be
Yeah.
accepted? Do I have the quality of note? Do I have a quality evidence of the quality care that we're giving? And people are saying, I don't know if I can afford it. And then talking with the National Council and folks, can I afford not to do it? So I think those are some of the things that are weighing on providers. And there are, other providers, and there are other technologies out there. I can say that, from RCPA's perspective, we've been working with Greenspace for a number of years. The foundational evidence behind what they do is reassuring. So, I don't have the answer to that question. But Sherry, you said it, or Mike said it. They're always looking for more. And I think with the uncertain times, I don't know what that more looks like, but I think providers should be prepared to be able to do it.
Yeah, Jim, I think the question is really in aligning the right data to the request of the managed care organizations, right? And we know that all at least in the state of Pennsylvania, a lot of our MCOs are tightening their belts. We're getting ready to sunset a big service line in CIRC, which is a community integrated recovery centers. And really they're starting to think about other ways to do it. But there's no doubt that what's going to be required for people to stay in the game is going to be proof that what they're doing is working, or that, or learning how they can do things with more efficiency, quicker, better, smarter, all the things. So I think both Michael and I'll speak for us, are not wondering if it's applicable or if it's helpful. We just don't know what to say about it at this point without knowing more.
It's also, but one thing for sure is that it's nimble, and
Yeah.
that's going to be a common denominator need indefinitely.
Yeah, like I think that's a key point when we have the shifting landscape, we have shifting reporting requirements. I think the whether it's nimble or flexible, like you got to be able to match the assessments and the kind of reporting dashboards to the needs of the organization, which are going to change,
Yeah.
and it's got to be integrated. Like those to me are kind of key pieces here.
Yep. I think anything that you guys can do to demystify the process and how it's done. I mean, we've all been talking about, it's sort of like value-based payments, like for the longest time.
Yeah.
We were like, okay, we'll do it. Can you just explain it though? Like, it takes a while for people. We're hearing it, it's in the vernacular, but do we really understand how to go about it? So
Yeah, and the approach, like not for this call, but the approach across managed care organizations is different in Pennsylvania, but all connected in the concept that there is a strong interest in getting to outcome data
yeah.
to understand the impact of positive outcomes on cost of care, to be able to use sort of the dollars more efficiently, and I'd say incentivize better outcomes, incentivize lower cost of care. But for those organizations, like for each of these MCOs, like it absolutely starts at understanding what the outcomes are. And that's where this comes in.
Great. Simon, on behalf of RCPA and its members, and Tanya as well, thank you for your partnership, and we look forward to kind of next level.